Welcome all. In this series of video, we will discuss about different microscopy pathology of second year, and we at first discuss about the blood pathology, the important microscopies. So at the first, we discuss about acute leukemia. It's mainly two types. One is ALL, one is ALL means acute lymphoid leukemia, or it may be AML means acute myeloid leukemia, but in the microscopy we cannot differentiate properly, so we write in the exam that it is acute leukemia. Okay, at first we can find the blast cells. These are the blast cells. Okay, these are the blast cells, these. So it may be the lymphoblast cell or maybe the myeloblast cell, but it is the blast cell. So what is the first point? Number of blast cell more than 20%. Okay, we can find the more blast cell here. It is quite abnormal. We cannot find like this in normal blood. And the blast cell has high nuclear cytoplasmic ratio. You can see the cytoplasm is very rare, very little cytoplasm. If you see this, the cytoplasm here cytoplasm, and nucleus is so big. So here the nuclear cytoplasmic ratio is very high, and you can find buttock shaped nucleus in AML M3. It is the FAB classification of acute leukemia. And if you can find aura rod, but here you cannot see the aura rod, but in some microscopy we can find here a rod like structure, These are the aura rods. Specifically it you can find in the AML means acute myeloblastic leukemia or acute myelogenous leukemia. So these are the points, and these are the microscopic features of acute leukemia. Next we goes to CML, chronic myelogenous leukemia. Here you can see different types of WBC, different types. Almost all types of WBCs in this microscopy. So here you can find the different types of WBC and different stages of maturation. So here it is the neutrophil, here it is the basophil. Okay, here it is the small lymphocyte, it is the large lymphocyte, it is probably the myeloblast cell. So you can find different types of WBC. Here you can also find, but it is a 10x zooming. So in this image you will see better structures. What are the points? So less than 2%, less than 20% of blast cell is present. Different stages of development of WBC is seen, and thrombocytosis is seen. Thrombocytosis means increased number of platelet. You can find it is the platelet. Okay, this is the platelet. So these are the platelets. So thrombocytosis is also seen. Next we goes to CLL. So CLL is chronic lymphocytic leukemia. The smudge cells are characteristic finding of the CLL. It is the smudge cell. Okay, it is the smudge cell. Here you can also see smudge cell. So these are the smudge cell. Smudge cell are seen, and you can see that one types of blast cells are here, means one types of WBC is here. And in CML the different types of WBC is present, but in CLL one types of cell are present. For the remembering purpose, we find that it is a college girl type, means the different dresses are here, but it is school girl type, means one types of cells are here. Okay, so and lymphocyte is predominant. These are the lymphocytes. So lymphocytes are predominant, and blast cell is less than 10% usually. So this is CLL, and now we goes to the hemolytic anemia. So now we discuss about hemolytic anemia. You also write in the exam that it is a microcytic hypoanemia. So in the larger way, you can see you can write it is a microcytic hypochromic anemia. Okay, so now we see that these are the nucleated RBC. These are the nucleated RBC. Okay, these are the WBC, but these are the nucleated RBC. Usually RBC has no nucleus, but here you can see the nucleated RBC. Sorry, it is not the WBC. Here it is the WBC. It is probably neutrophil. Okay, so we will see the many nucleated RBC. It is a characteristic finding of hemolytic anemia. Here also some teardrop cell. These cells like a teardrop. Okay, drop of water here, and it is so lots of teardrop cells are also present. And the target cells, means usually the RBC has a central pallor, yes, like this, but target cells is like this. So you can find here it is a target cell, it is also a target cell, it is also a target cell. So these three cells, it is also a hemolytic anemia, but in this slide you can see properly the all types of cell. So what is the point? What are the points? That target cell, teardrop cell and nucleated RBC is seen. You can write in the 3 points from the point 1 also, and central pallor is more than 1/3 of RBC. You will must see that central pallor is more. Usually the RBC is like this, but here the central pallor is more, is larger central pallor. Okay, so these are the microscopic features of hemolytic anemia. Then we discuss about the eosinophilia. The man who which has allergy or parasitic infection, we can see the eosinophilia. So these, it is eosinophil, and eosinophil. So what you should write in the exam? That bilobed nucleus is seen. Now see the 2 lobes. Okay, 2 lobes. So bilobed nucleus is seen. Spectacle shaped nucleus, yes, this type of structure you can see here. Okay, this spectacle shaped, light spectacle. And cytoplasm is filled with course of brick red granules. Granules are properly seen here, not clearly seen, but you can find that there is lots of granules. So granules are seen, and it is seen in parasitic infection and allergy and Helminthi's disease. So it is the eosinophilia. Next we goes to neutrophilia. These are the neutrophils. So number of neutrophils is more than usual. Coarse ropey pink cytoplasm. Okay, pink cytoplasm is here, and number of lobes is 2 to 7. More numbers, 1 2 3 4 5 6 here. 1 2 3 4 5, 1 2 3 4 5. So there is 2 to 7 lobes are you can see, and seen in acute inflammation and exercise. So these are the all important microscopy in hematology of second year pathology. Thank you.